41. A patient is recovering from thyroidectomy. What is the priority assessment? A. Assess for hoarseness. B. Monitor calcium levels. C. Evaluate pain level. D. Assess incision site. Answer: B. Monitor calcium levels. Rationale: hypocalcemia due to parathyroid damage is a major complication after thyroidectomy. 42. A patient with sickle cell anemia is admitted with severe pain. What is the priority intervention? A. Start 4 fluids. B. Apply cold compresses. C. Encourage ambulation. D. Administer aspirin. Answer: A. Start 4 fluids. Rationale: for hydration reduces sickling and prevents further occlusion of blood vessels. 43. A nurse is caring for a patient with diabetes insipidus. Which order should the nurse anticipate? A. Administer insulin. B. Restrict fluids. C. Administer desmopressin. D. Give potassium supplements. Answer: C. Administer desmopressin. Rationale: desmopressin, DAP, replaces antidiuretic hormone, ADH, to reduce excessive urine output. 44. A patient with a total hip replacement reports sudden calf pain and swelling. What should the nurse do first? A. Elevate the leg. B. Encourage ambulation. C. Check pedal pulses. D. Notify the provider. Answer: D. Notify the provider. Rationale: sudden calf pain and swelling may indicate a deep vein thrombosis, DVT, requiring immediate intervention. 45. A patient is prescribed furosemide for heart failure. What is the most important lab value to monitor? A. Sodium. B. Potassium. C. Creatinine. D. Hemoglobin. Answer: B. Potassium. Rationale: furosemide is a loop diuretic that can cause hypokalemia, leading to dangerous arrhythmias. 46. A nurse is monitoring a patient post-thoracentesis. Which finding requires immediate intervention? A. Decreased breath sounds on the affected side. B. Mild chest discomfort. C. Respiratory rate of 16. D. Small amount of serous drainage. Answer: A. Decreased breath sounds on the affected side. Rationale: this may indicate a pneumothorax, requiring immediate intervention. 47. A patient with a chest tube has continuous bubbling in the water seal chamber. What does this indicate? A. Normal function. B. System leak. C. Tube obstruction. D. Pneumonia. Answer: B. System leak. Rationale: continuous bubbling in the water seal chamber indicates an air leak in the system. 48. A patient with pancreatitis has a Cullen sign. What does this indicate? A. Hypovolemic shock. B. Intra-abdominal bleeding. C. Hypokalemia. D. Electrolyte imbalance. Answer: B. Intra-abdominal bleeding. Rationale: Cullen sign, periumbilical bruising, suggests retroperitoneal bleeding. 49. A patient with a femur fracture develops dyspnea and petechiae on the chest. What should the nurse suspect? A. Pulmonary embolism. B. Fat embolism syndrome. C. Deep vein thrombosis. D. Pneumothorax. Answer: B. Fat embolism syndrome. Rationale: long bone fractures can lead to fat embolism, causing respiratory distress and petechiae. 50. A patient is receiving chemotherapy. Which lab value requires immediate intervention? A. WBC 2,000/mm superscript 3. B. Hemoglobin 12G/DL. C. Platelets 180,000/mm superscript 3. D. BUN 15 milligrams per deciliter. Answer: A. WBC 2,000/mm superscript 3. Rationale: a low WBC count increases the risk of infection, requiring neutropenic precautions. 51. A patient with a head injury develops clear nasal drainage. What is the priority action? A. Test the drainage for glucose. B. Elevate the head of the bed. C. Apply a nasal drip pad. D. Encourage the patient to blow their nose. Answer. A. Test the drainage for glucose. Rationale. Clear drainage may indicate cerebrospinal fluid, CSF, leak, which tests positive for glucose. 52. A nurse is caring for a patient with a new tracheostomy. What is the priority nursing action? A. Deflate the cuff regularly. B. Keep a tracheostomy obturator at the bedside. C. Provide oral care twice daily. D. Encourage deep breathing exercises. Answer. B. Keep a tracheostomy obturator at the bedside. Rationale. The obturator is essential for reinsertion if the tracheostomy tube becomes dislodged. 53. A patient with heart failure has a BNP level of 900 pg/ml. What does this indicate? A. Normal cardiac function. B. Mild heart failure. C. Moderate heart failure. D. Severe heart failure. Answer. D. Severe heart failure. Rationale. BNP levels greater than 900 pg/ml indicate severe heart failure. 54. A patient with tuberculosis is placed in isolation. Which type of precaution is required? A. Contact. B. Droplet. C. Airborne. D. Standard. Answer. C. Airborne. Rationale. TB is transmitted via airborne particles, requiring an N95 mask and negative pressure room. 55. A patient on warfarin has an INR of 5.2. What is the priority nursing intervention? A. Administer vitamin K. B. Increase green leafy vegetables. C. Continue monitoring. D. Give an additional dose of warfarin. Answer. A. Administer vitamin K. Rationale. An INR 5 increases bleeding risk, requiring vitamin K to reverse anticoagulation. 56. A patient with end-stage renal disease has a GFR of 12 milliliters per minute. What is the expected intervention? A. Increase fluid intake. B. Start hemodialysis. C. Encourage high-protein diet. D. Discontinue medications. Answer. B. Start hemodialysis. Rationale. A GFR less than 15 milliliters per minute indicates kidney failure, requiring dialysis. 57. A nurse is assessing a patient with a pneumothorax. What finding is expected? A. Hyperresonance on percussion. B. Bilateral crackles. C. Increased breath sounds. D. Bradycardia. Answer. A. Hyperresonance on percussion. Rationale. Air accumulation in the pleural space causes hyperresonance. 58. A patient with cirrhosis develops hepatic encephalopathy. What lab value supports this diagnosis? A. Elevated ammonia levels. B. Increased bilirubin. C. Decreased albumin. D. Low hemoglobin. Answer. A. Elevated ammonia levels. Rationale. Ammonia buildup affects brain function, causing encephalopathy. 59. A patient is prescribed spironolactone. What should the nurse monitor? A. Hypokalemia. B. Hyperkalemia. C. Hyponatremia. D. Hypocalcemia. Answer. B. Hyperkalemia. Rationale. Spironolactone is a potassium-sparing diuretic, increasing the risk of hyperkalemia. 60. A patient with appendicitis reports sudden relief of pain. What should the nurse do? A. Reassess in 1 hour. B. Notify the provider immediately. C. Encourage ambulation. D. Provide oral analgesics. Answer. B. Notify the provider immediately. Rationale. Sudden relief of pain may indicate appendix rupture, requiring emergency care. 61. A patient with hypertension is prescribed lisinopril. What side effect requires immediate attention? A. Dry cough. B. Dizziness. C. Angioedema. D. Fatigue. Answer. C. Angioedema. Rationale. Angioedema, swelling of the face and airway, is a life-threatening reaction to ACE inhibitors. 62. A nurse is caring for a patient with a colostomy. Which food should the patient avoid to prevent gas formation? A. Yogurt. B. Applesauce. C. Broccoli. D. Rice. Answer: C. Broccoli. Rationale: broccoli causes gas buildup, leading to colostomy discomfort. 63. A patient with deep vein thrombosis, DVT, is receiving heparin. Which finding requires immediate intervention? A. Bruising on the arms. B. Hematuria. C. Pain at the injection site. D. Mild headache. Answer: B. Hematuria. Rationale: hematuria indicates bleeding, a serious side effect of anticoagulation. 64. A patient with a stroke has expressive aphasia. What is the best nursing intervention? A. Encourage the patient to write responses. B. Speak loudly and slowly. C. Use medical jargon. D. Ask yes/no questions. Answer: D. Ask yes/no questions. Rationale: simple yes/no questions improve communication for patients with expressive aphasia. 65. A nurse is providing discharge teaching for a patient with GERD. What should the patient avoid? A. Small, frequent meals. B. Lying down after eating. C. Weight loss. D. Sleeping with the head elevated. Answer: B. Lying down after eating. Rationale: lying down after meals increases acid reflux. 66. A patient with asthma has audible wheezing and is using accessory muscles. What is the priority action? A. Administer albuterol. B. Provide oxygen. C. Encourage pursed lip breathing. D. Obtain a chest X-ray. Answer: A. Administer albuterol. Rationale: albuterol is a bronchodilator that quickly relieves airway constriction. 67. A nurse is caring for a patient with a hip fracture. What is the priority assessment? A. Bowel sounds. B. Capillary refill. C. Temperature. D. Urinary output. Answer: B. Capillary refill. Rationale: poor capillary refill may indicate impaired circulation due to fracture. 68. A patient with ulcerative colitis is experiencing frequent diarrhea. What dietary advice should the nurse provide? A. Increase fiber intake. B. Follow a low-residue diet. C. Avoid all dairy. D. Eat high-fat foods. Answer: B. Follow a low-residue diet. Rationale: a low-residue diet reduces stool frequency. 69. A nurse is reviewing lab results for a patient receiving digoxin. Which finding is concerning? A. Potassium 3.0 milliequivalent/L. B. Sodium 138 milliequivalent/L. C. Digoxin level 1.2 nanograms per milliliter. D. Hemoglobin 14G/DL. Answer: A. Potassium 3.0 milliequivalent/L. Rationale: hypokalemia increases the risk of digoxin toxicity. 70. A patient with diabetes is sweating and confused. What is the priority intervention? A. Check blood glucose. B. Administer insulin. C. Provide fluids. D. Monitor urine output. Answer: A. Check blood glucose. Rationale: sweating and confusion are signs of hypoglycemia, requiring immediate glucose testing. 71. A patient with hypocalcemia is being assessed. Which finding is expected? A. Trousseau's sign. B. Bradycardia. C. Hypoactive reflexes. D. Decreased bowel sounds. Answer: A. Trousseau's sign. Rationale: hypocalcemia causes neuromuscular excitability, leading to Trousseau's sign, carpal spasm with BP cuff inflation. 72. A nurse is preparing to administer packed red blood cells. What is the priority action? A. Prime tubing with normal saline. B. Infuse over 6 hours. C. Check blood glucose before administration. D. Monitor potassium levels. Answer: A. Prime tubing with normal saline. Rationale: Normal saline prevents clotting and hemolysis. Blood products should be infused within 4 hours. 73. A patient with a new colostomy is worried about body image. What is the best nursing response? A. You will get used to it over time. B. Let's talk about your concerns. C. You can hide it under loose clothing. D. It is a necessary procedure. Answer. B. Let's talk about your concerns. Rationale. Open-ended questions encourage expression of feelings. 74. A patient with pneumonia is receiving 4 antibiotics. Which finding requires immediate action? A. WBC count of 15,000/mm superscript 3. B. Respiratory rate of 28. C. New onset confusion. D. Productive cough with yellow sputum. Answer. C. New onset confusion. Rationale. Confusion in pneumonia patients can indicate hypoxia or sepsis. 75. A patient with COPD is receiving oxygen at 4 liters per minute via nasal cannula. What should the nurse do? A. Lower the oxygen to 2 liters per minute. B. Encourage deep breathing. C. Position in high Fowlers. D. Increase oxygen to 6 liters per minute. Answer. A. Lower the oxygen to 2 liters per minute. Rationale. High oxygen levels can suppress the respiratory drive in COPD patients. 76. A patient with rheumatoid arthritis is prescribed methotrexate. What should the nurse monitor? A. Liver function tests. B. Blood glucose levels. C. Calcium levels. D. Sodium levels. Answer. A. Liver function tests. Rationale. Methotrexate is hepatotoxic, requiring liver function monitoring. 77. A nurse is assessing a patient with pericarditis. What is an expected finding? A. Pericardial friction rub. B. Absent breath sounds. C. Hyperactive bowel sounds. D. Crackles in the lungs. Answer. A. Pericardial friction rub. Rationale. Pericarditis causes inflammation, leading to a characteristic friction rub. 78. A patient receiving furosemide reports leg cramps. What lab value should be checked? A. Potassium. B. Sodium. C. Calcium. D. Magnesium. Answer. A. Potassium. Rationale. Furosemide is a loop diuretic that can cause hypokalemia, leading to muscle cramps. 79. A nurse is caring for a patient with a chest tube. What is a concerning finding? A. Continuous bubbling in the water seal chamber. B. Intermittent bubbling in the suction chamber. C. Drainage of 50 milliliters per hour. D. Slight chest discomfort. Answer. A. Continuous bubbling in the water seal chamber. Rationale. Continuous bubbling indicates an air leak. 80. A patient with a spinal cord injury at T6 is experiencing autonomic dysreflexia. What is the priority action? A. Check for bladder distension. B. Administer pain medication. C. Lower the head of the bed. D. Apply warm compresses. Answer. A. Check for bladder distension. Rationale. A full bladder is a common trigger for autonomic dysreflexia.